Thank you very much indeed for joining us. I'm glad to see that something's finally happened here, because I've been asking for months, basically. Why can't somebody tell these doctors to see more patients?
Yeah, I think that's absolutely right. Look, I think this has become a binary issue, that face-to-face is good and remote consultation is bad. It's not as simple as that. Properly used, remote consultations can and should save a lot of time for doctors and patients. And some of my patients actually want remote consultations. They'd rather not come in, and simple things can be dealt with remotely. The problem is a lot of GPs used it as an excuse to shut up shop in March 2020, and they have not reviewed their internal procedures for 18 months, using it as a weapon just to stop patients coming in. And it's, there have been some horrific stories. There was one on social media last week, a chap with a lump who was told it was an infection, given antibiotics. He eventually demanded a face-to-face consultation. Then he got referred to the hospital, where he's told, well, it's cancer and it's incurable, but if you come to us sooner, we could have cured you. And I've seen similar cases like that in my practice.
Yes.
So the doctors have not used it appropriately. They've used it as a way of stopping patients coming in. And I have to say, one of the drivers behind this is often the reception staff. In my experience, reception staff have been the toughest at not wanting to have patients breathing COVID all over them. So they've basically said, no one comes in, whether it's COVID related or not. And that's a problem. Look, I can understand. You don't want to see patients with cough or fever. But if someone has got something that's unrelated to COVID, they should have a face-to-face consultation if that's doable. And you can use remote consultations for paperwork, for repeat prescriptions and simple things, but not for diagnosing illness. Not saying to people, take a photograph of your earache, as someone was asked, or take a photo of the ulcer on your leg.
Yeah.
And the doctors have misused a very useful technology. And unfortunately, I think what they've done is they've spoiled remote consultations, which actually can have some use and some benefit.
Yes, I mean, some people are quite happy to have remote consultations, and if they can get, say, for example, a prescription repeated and picked up without having to actually go to the doctor, fine. I've got no problem with that. But all I always say is that if you require to see a doctor and you want to see a doctor, then you should be able to, and it shouldn't be so difficult that you basically end up giving up and going private.
Yeah, or just turning up at A&E, which a lot of people have been doing. I spoke to someone who works in A&E recently, and they said that has increased their workload. It has to be said, though, the GPs will tell me that workload in general has gone up because of anxiety created around the pandemic. And it's not a very good model of healthcare. The general practice only works if very few of the patients even bother the GP. The funding is such that the GP gets £155 a year for every patient, and they can only make it work if 5% of the patients turn up and the rest stay up, never bother them. And I think that has balanced on a fine knife edge for a long time. It wasn't good before the pandemic. It was taking 2 or 3 weeks to get an appointment before the pandemic. And I think this has exposed the fact that if people have health anxiety, they're going to demand a service that's free of the point of use and actually cause it to collapse. And that's exactly what has happened here.
Yes, but if we are to believe that today is the sort of first day back at the office, as it were, and there's thousands more people coming into town to go and work in an office rather than working from home, I don't understand why doctors seem to think that they're somehow a different category than everybody else. Because we're not doing social distancing anymore. They don't need to do it inside of their own GP surgery. Their waiting room can be full of people if necessary. I mean, people were sitting there for years giving each other all sorts of things. I mean, I don't know why suddenly that's now a problem.
No, they're choosing it to be a problem because once rules come in, it's very difficult to unravel them. And that's what's happened here. They're still stuck in March 2020 with keeping people away and having screens up and masks and so on. I mean, I was out in the West End yesterday. It was heaving. Everyone's out and about and enjoying life normally. And I agree with you. There's no reason at all why GPs shouldn't be going back to normal. With 94% of the population with antibodies against COVID, GPs should actually be going back to normal, but they're not, and they have not covered themselves with glory during this crisis, the GPs, I'm afraid, and they have shown themselves in some cases, not all, some cases, not to actually care enough about their patients.
It is extraordinary, and we also hear a lot of stories, Dr. Laurence, about people going part-time I've still never quite got a proper answer as to why that's the case. My sense is that some of them are going part-time in order to do other work which will make them more money.
Oh yes, but and I can defend that because I have doctors working for me here in the private sector who also work part time in the NHS. It's a workload problem. When I was a GP partner, I was committed to my practice not only 7 days a week, but in those days 24 hours a day, and it was a full time job. Now, of course, with more than half the doctors being trained being women with more take on more family commitments, although the men should do it equally, but the women take on more. Most GPs are part-time nowadays. It's not just to earn money, and a lot of doctors have what known as portfolio careers. They'll do 2 or 3 different jobs, a bit of locum work, a bit of work for Babylon, which is an app that does remote consultations, a bit of private work. But workforce issues have been a problem for general practice for a long time. It's a tough job, and that's why I left the NHS. It's one of the toughest jobs in the world, and that's partly because of the way it's designed. It's too far separated from hospital medicine. There's a huge tribal difference between hospital medicine and general practice, so it becomes a job with not enough career prospects compared with hospital doctors and so on. So I will defend GPs. It's a very hard job, and as I say,
I'm sure it is. But I mean, with the best will in the world, and with all due respect to GPs, nobody's making them do it. You go in to do your training to become a doctor. You can then decide which part of the business you want to go into. If you choose to be a GP, should you not be choosing to do a GP's job because that's what you want to do, rather than doing it for a bit and then going, yeah, do you know what? I don't really fancy this. I think I'll do a couple of other things on the side.
You're absolutely right, Mike. And all jobs are. People have pressure in all jobs. I speak to young people in other professions who work as hard or harder than GPs, and they have the same stress and worry as well. And GPs are very well paid, so they can afford, you see, to work 2 or 3 days a week and earn enough to pay their bills and to do other things. But I just want to look at the whole structure of healthcare funding. I think now this is thrown up. We've been sweeping it under the carpet for too long. Now let's look at it properly. Let's have people. I think you said let's have people pay £5 or £10 to see the GP and to go to A&E, because you can't. If they just had to pay to go to the GP, they'd all pitch up at local hospitals because that'd be free. Let's bring that in now. There's no reason why someone can't afford that, and if they can't afford it, then they can find there should be charitable options for people to find ways to see a GP, but it will act as a barrier because the increase in demand from the worried well has overwhelmed both accident emergency and GP practices, and it's not often spoken about. You work in the media, you're a journalist, you're the sort of person that would only go to the doctor if there's something wrong with you, something obvious and major. And when someone like you came into my consulting room in the NHS, I would actually be relieved because it would be seeing someone who's not chronic sick or mental health or disability, but someone with a straightforward problem that I think I might be able to help. But that sort of patient's actually rare in general practice. Yes. Most of the patients coming in are the worried well with complex, false ideas. I've had a patient this morning convinced he had cancer, and I had to persuade him he hasn't. I've done blood tests and so on and so forth. But the people don't talk about how much the worried well burden a system that has limited resources. And every worried well person that has a brain scan, a blood test, a chest x-ray, all of those things, that's all going to cost money. They're all going to turn out to be normal, but the resources have been used up. And I want the resources to be saved for seriously ill people, people with cancer, people with mental health issues, people with heart disease. And that's what the health service should be doing. We should be focusing on that, and could be controlling demand at the entry level.
Yes, I think you're absolutely right. Dr Laurence Gerlis, thank you very much indeed. GP at same day doctor. It's not difficult, is it? This is the whole problem with the NHS, as I say, till I'm blue in the face. And by the way, I like the idea that Dr Laurence would like to see me if I came into his surgery. Some people would say there are already quite a lot of things wrong with me.